Good morning from Miami Beach. This is Dr. John Bennett broadcasting from the studio of Neurosurgical TV. We're starting a new webcast with Elena. We're basically going to go over some of the stories of the week, and we'll just take it as it comes. And we'll give some input of what we know. I'm not a neurosurgeon, but I can give a little input. And we can have guests like Naran give input. Okay, I'd like to introduce Naran. Hello, Naran. Welcome.
Hi, this is Naran and Jonikram from India. I am a skull-based surgeon. I operate primarily on skull-based tumors. And welcome. I really congratulate Dr. John for this excellent endeavor.
And
welcome, Elena.
Yeah, he is a very active ENT group. Okay, and we have a few more guests that will be coming in. Okay, Elena, can you introduce yourself? And away we go.
Greetings to all neurosurgery passionates. This is Elena Nestian here from Romania. I am a fifth-year medical student from Carol Davila University of Medicine and Pharmacy, Bucharest. And also, I am the president of the Romanian chapter of the Walter E. Bendy Neurosurgical Society, headed by Professor Salim Abdurrauf. And I'm honored to accept Dr. John Bennett's invitation to present today the news review of the week on Neurosurgical TV. And thank you so much for joining us.
You're welcome.
So,
you want me to share the stories, Elena, or do you want to share them?
I'll share them. Just
okay, yeah, you can control it.
Okay, do you have my screen now?
Yes.
Okay, so this is the main page of Neurosurgical TV, which I think is a very successful platform because I really believe that Dr. John Bennett succeeded to give neurosurgery a voice and a face. And I'm really grateful to be part of this vibrant community of young neurosurgeons and mentors, such as Dr. Ip Cherian from Nepal or Yuka Hernandez, which are huge names, and I'm happy to have this chance to interact with them. Okay, so what we can see now when we go on the first page is the poster of this event. Thank you so much for everyone joining us at this time, and please do interact with us at the end of this short review. Another event that is going to take place today at 6 p.m. Cameroon time is the presentation by the African group on neuroanatomy. I really encourage you to join the anatomy sessions, and I congratulate them for this effort. I'm trying to make the time and be on the panel as well.
Well, you know, Elena, let me just interject. We have the Ulrich Sidney here on the panel, I believe. Are you here, Ulrich?
Yes, I am.
Okay, there he is. There's the guy that started that series, Elena.
Yeah,
medical student. He's a medical student from Cameroon.
Yes, I've met him last week. I think during Dr. Samer's presentation, right?
Very good. Okay. Sorry to interrupt.
I'm looking forward to meeting him in person. Who knows, at a world conference or something.
Are you going to China? Are you going to China, Elena?
Thank you for joining us, Ulrich. Moving on, you can see here the recorded meeting on acute pain syndromes done by Seattle Science Project. Very nice presentation and full of information. And now you can see a story, Alex Baker's Parkinson's disease and DBS story. I haven't been through it, but I'm really looking forward to it. It's very
can I comment on that, Elena? I read the story because a friend of mine has essential tremor, and that's one of the proposed uses for DBS. in which this gentleman had Parkinsonism and he's a neurosurgeon. He was successfully treated with DBS. Okay, sorry to interrupt.
It's welcome. As neurosurgeons, we are very afraid of tremor. Myself, I'm very afraid of tremor. I'm constantly looking at my hands to see if they are steady. And I'm really looking forward to reading the story just after we finish this meeting.
Okay.
And here you can see the recording meeting taken on 31st of May, also by the African Association of Future Neurosurgeons on the neuroanatomy of the ventricular system. They are a very active group of students, and they are constantly making anatomy presentations, and I really congratulate them for the work. Maybe we could join our group.
That would be great. That would be great.
I really like
That would be a great idea.
Yeah, or they have a pretty sizable neurosurgery student community in Romania. Obviously, the Walter Dandy, she's the head.
Yes, well, we usually meet two times a month at the hospital at Bagdazar Arseni Clinical Emergency Hospital in Bucharest. We like to meet in person and interact and practice neurological examination just there in person, because it's the next level of interaction.
Right. Okay.
But this time of the year is full of exams for students, so we won't meet at the hospital anymore. And I really think this community, the Neurosurgical TV, could help us stay close during the exam times.
Okay.
Okay, this is an interesting title, The Story of Cash. Virtual reality at Stanford helps with misdiagnosed Moya disease. Okay, it's an interesting title. I'm gonna go through it right after. And in this news, we're gonna see a new treatment that Houston brain trauma patients can enroll on. And the aim of the study is to evaluate the potential benefits of the treatment based on oxygen levels. Looking forward to the results. Okay, and an interesting presentation by IT Cherian on the modified Dolex and modified Kawase approaches. Yes, as a student, this topic seems very, very complicated. I've read about the Kawase approach, and it really involves very solid knowledge anatomy. So as students, we should first know very well the anatomy and then go to this presentation, because it's really gonna help us integrate all the pieces. Okay, and what I was talking about, Dr. Samer's presentation on neurosurgical surgical anatomy, on the topic filling the gap between Roton and Snell's neuroanatomy. I had the chance to be on the panel and listen to the presentation, at least the last part of it, and it's a very good thing to integrate all the input, all the information, go to the atlas, anatomy atlas, go to Roton, see imaging studies, and then go to intraoperative studies and develop the 3D see-through vision of the brain, about which Dr. Roton, the great microneuroanatomist, was talking about. And if you are interested, at the end of this presentation would be a slide full of books which are recommended by Dr. Samer to read, and it's a very useful resource to be oriented which books. So there are thousands of books, but those are really, really good ones.
Okay.
Okay, I've been through the ventricular system, and this is something that I've been reading on my way to the hospital this morning. It's an article written by Dr. Mark McLaughlin on 4 things to avoid burnout, and I really enjoyed it. I
Well,
recommend.
let me just remark, Elena. Mark wrote me. He's written a book that he's going to come on Neurosurgical TV about issues like this, as well as others. So he's an active member. I believe he's a neurosurgeon from North Carolina, that part of the world, I think.
I really enjoyed going through the article. I like very much reading books, and I'm very enthusiastic about people who are both neurosurgeon and artists. And I would really like to meet him in person because he has more articles on this topic.
Yeah, I'm sure you'll be able to ask him personally when we have the session.
Yeah, I really love to. Okay, and I think that's it. Another thing that I would like to say is that I want to thank Dr. John Bennett for creating the Romania channel on Neurosurgical TV as well.
Okay.
And if you have the curiosity to click on it, you're gonna see 2 of our broadcasting meetings. It's not that much, but it's a start, and we're hoping to make more broadcasts on Neurosurgical TV next year.
Well, excellent. Okay, Elena, thanks a lot. You know, this is new here, and you and I don't have a lot of neurosurgical experience, but however, we can give our input. And Ulrich, welcome. Let's welcome Ulrich. Hello, Ulrich.
Hello.
Are you there, Ulrich? Oop, I have a couple more people here. Italian neurosurgeon coming in. Hold on, let me just. I just want to make a remark about one of these stories. You know, when I saw the drilling in Houston, the drilling some patients' cranium when they come in from head trauma to, it's not, what caught my eye was, I thought it was, hello, Marco.
Hey, John, how are you?
Welcome. You know Elena, right?
Yeah, I'm in line, yeah.
Yeah, and we have another guest here. Oh, we popped off. Anyways, what caught my eye, Elena, is, as you know, I period cisternostomies where they drill into the cistern to relieve the pressure. That what drew me to the article, but it's just drilling to measure the ICP. It's not a therapeutic. It's just a monitoring thing. So, Marco, have you done any cisternostomies at all?
No, actually, cysternostomy, I saw some many cysternostomy endoscopically, but never performed one. We used to perform directly ventricular peritoneal shunt or ventricular atrial shunt.
Oh, okay. Okay, yeah. Just how do you normally monitor the ICP when a patient comes in?
Yeah, that's great.
How does one? Okay, you have a severe head trauma. How do you measure the ICP?
Well, usually we perform the cerebrospinal fluid test. It means we perform a lumbar puncture,
okay,
and then we connect with a Luer lock to the anesthesiology monitoring to check the same method to measure the central venous pressure. In this case, made to measure the cerebrospinal fluid pressure. So we can have a monitoring during several minutes, and we use the system to measure the basic pressure, and also a measure of the compliance injection ringer fluid throughout the lumbar puncture, and we have the measure of pressure, the cerebrospinal fluid pressure during these minutes. In this way, we can measure if there is a condition of normal pressure hydrocephalus. There are several workings literature that tell that using this monitoring during several minutes, and we can have a good sensibility and specificity for a diagnosis of normal pressure hydrocephalus.
Well, you know, Marco, during my days as an emergency medicine doctor, there was always a question of whether or not to give steroids to a severe head trauma that came in, and we'd call the neurosurgeon, do you want to give steroids? Do you not want to give steroids? Is that pretty well over? People aren't giving steroids now for head trauma?
Yeah. If we have severe head, brain swelling, is advisable. We injection dexamethasone. Yeah. We injection dexamethasone 8 milligrams usually intravenously.
Oh, okay.
Yeah, absolutely. We don't use a diuretic like mannitol because in this case the blood-brain barrier is injured. So mannitol is usually create more swelling than benefits.
You understand that, Elena, right? The story of steroids and head trauma. Have you heard about that, Elena, at all?
I've been in India to a conference on brain trauma. I think they're organizing this conference every autumn in New Delhi. And Professor Deepak Gupta is the one organizing it. I don't remember. I was
yeah, that's okay.
Back then, but I know that we as neurosurgeons make use of corticosteroids for brain tumors, and I don't know if there is any there are any particularities in a severe head trauma compared to a mild one.
Well, that brings up a question, how that's actually a medical practice of neurosurgery. It's more than just the surgical skills of using your hands. You've got to manage the patient medically. How much do you manage that patient medically, Mark? Do you like work on the blood pressure of the patient, etc., or you leave that to an internist?
Absolutely. Are you asking to me, John?
Okay, so you control that. You want to keep control of that.
Yeah, absolutely. It's a two hands work with the help of an intensive care consultant and with neurosurgeon, because we have the monitoring of intracranial pressure in the severe trauma. Obviously, is mandatory to put an intracranial pressure monitoring, and we work together discussing what's the best option for the patients, not only control brain swelling, but also case of a paroxysmal sympathetic storm, so adrenergic state that can be controlled sometimes by use of beta blocker. I remember a panel you did in Spanish language about beta blocker. Very interesting.
It was from Italy, actually. That conference.
Oh yeah.
It was from Venice.
From Venice, right?
From Venice. They gave the presentation from their dinner table on a smartphone.
Great.
Yeah, it was good.
Typical Italian style. So good food, good neurosurgery, right?
Good with teaching. But good combination. Elena, could you tell us a little bit about the Walter Dandy and what you're doing, how you organize and stuff? Because you're providing education to kids that like neurosurgery.
Yes, we are a young association of students. We are a scientific circle. We are not an NGO. So everybody is doing voluntary work. And the key factor is passion for neurosurgery and dedication and commitment. We are both students and residents. Francesca, you know her. She was a student. Now she's a resident, and she keeps on coming to our meetings and helping us and sharing with us her experience in the OR and telling us tips and tricks how to be a good neurosurgery resident, what to do, what to avoid, what it's like in real life to do to go into surgery.
Okay.
And we usually meet 2 times a month.
And
We
can you tell
encourage
us what the Kathmandu meeting is? A pretty big meeting in Kathmandu, right?
yeah, once a year, the Dentist Society has a global meeting. The previous ones were in New Mexico or in Cabo, I think. Another one was in St. Louis, and this year is in Nepal.
Wow. Kathmandu, you get to go to Kathmandu.
Yeah, I'm really looking forward to.
Yeah, it's a pretty
Yes.
city. It's a lot of temples. It's really a lot of history. A lot of history there.
Never performed one in Italy, Helena.
Oh yeah. Well, is there a Walter Dandy in Italy? Do you know, Elena? They're all over the world, right?
Yeah, I think there is a chapter in Italy. I'm gonna check right now.
Okay.
And we were very honored to have Dr. Salim Abdul Rauf at an online chat during our last meeting at the end of the May. And he's really helping us a lot. And I was thinking about trying to connect with the Dendi community of students worldwide. Anyway, in Kathmandu, this September will be in the first day a special course for students.
Do
So
you have the schedule? You can go over the schedule if you
all
want.
over the world.
Do you have the schedule made or no? Not yet.
The schedule is
Not yet. Okay. All right. Well, you can just show us when it's ready.
what we know for sure is that there is gonna be one Dendi 101 course, Introduction to Neurosurgery for Students and Residents, and the same day is gonna be a workshop on bypasses techniques.
Okay.
And then it's gonna be the conference, but I do not have the schedule by now.
Okay, to be in the Walter Dandy, do the students do anything, or do they write stuff, or they just come to the meetings? They do
As
to be part of the
we encourage students to do research, and this year, me and my team, the organizing team, we have written a program. Let's see what topics we're gonna talk about this year, and we post it on our group, and the students chose the subject that they enjoyed, and they were the ones to present. I had presentations as well, but we encourage students to pick a topic, like I want to talk about the posterior cerebral artery or stroke, and we keep contact constantly, and we give them feedback. We encourage them to read certain books. We have a drive. We have a lot of books there, and they can access them freely.
Well, networking is part of all these, and this example is Naru from Morocco. Hello, Naru. Come meet Elena. Say hello to Elena Nestian, a medical student.
Hello, John.
Who's,
Hello, Elena. Hello, Marco.
Hi,
I
man.
hope, how are you doing?
Hi, for visiting us.
Fine, miss.
Thank you.
yeah, both of you guys are at work.
Yeah.
Yes.
Yeah, Elena, you have the day off, right?
And I am free today, so.
Oh, okay. Very
Yeah,
good.
Yeah,
just from the hospital.
you just finish your parenting room. Yeah.
Oh, nice. Yes, I see that you are in your pajama and your clothes. Nice.
Thanks.
What did you have in the OR, Dr. Marco?
Sorry?
What was the case for today in the operating room?
Very simple in terms of surgery. It was a lumbar discal hernia, extraforaminal. But it's very difficult because the patient was a fine eater. It's very large, so very deeper, very deeper. But I made to remove the hernia, and I just saw him, and he feel very good. And the last time we performed a craniotomy to removal of a temporal insular neoplasia. Very strange because it seemed a glioblastoma, but now I hear about the pathologist, and it's definitely a lung carcinoma.
Oh,
Yeah,
interesting.
yeah.
Yeah.
But we are ready to move the patients in oncological department because at the total body CT scan there is also a pleural carcinomatosis. It's very bad. So we hurry to yeah, we are to start the chemotherapy for this young poor man.
And the patient was unaware of his pulmonary neoplasia, right?
Yeah,
So
absolutely.
the
It
first
was
time he learned about it.
Hey, any question you want to ask, you can ask them. You can ask Naru. Naru, any questions too, if you want, Elena. If not, we can just close it up.
I have one question for
Okay, go ahead. Go ahead.
Dr. Marco.
Yeah, tell me.
Okay.
Last time I performed one case about disc herniation, and the problem what I have in the per procedure is about this herniation disc was calcified, and it is very difficult and hard to remove that. And I was afraid to enjoy the radicel. So what I had done, I performed just foraminotomy, large foraminotomy, to decompress the roots, and I let them in place. I don't know if you have idea about that, but in post-op, patient the pain go on, and the recovery about his satialgia, and I have good outcome. And I think
perfect.
about another case that one colleague done, and try to remove that, and after surgery person can't be walk. So I think that when we have disc herniation with calcified and so strong to remove, it is better to just perform foraminotomy and let them in the place. I don't know if you have idea about especially these cases of herniation disc.
Yeah. I performed several cases where the hernia was calcified. Usually, some cases I was able using the forceps, hernia forceps, to reduce the calcification, so get about plane the disc. But some case was very hard, I think, like your case.
Yeah.
So in this case, I performed foraminotomy. That's the best thing you can do, and you did the best things. And the proof is the patients feel better.
Okay,
So,
I read in some papers, some neurosurgeon perform take a drill and drill the calcification. But me, I was so afraid to do that.
yeah,
If you don't mistake, you can go down and enjoy cord. Okay.
No, don't worry. If you're not sure, or you don't have a good helper, a good junior doctor that keep safe the roots using a Klemberg structure, don't attempt to use the drills. It's a very risky. If you touch the roots, is a disaster. It's a disaster.
Okay. Yes, disaster.
You don't have excuse. So you did the right things. Absolutely. Very good.
Thank you.
Thank
You're
I
welcome.
don't know you, Elena Nestian. Can you present yourself to me, please? I remember we just done last webinar together, but I don't have occasion to know you, but I see that you come from Walter E. Dundee. No, so you know Professor Salim. I know one famous about this topic, Professor Samin. I hope. Professor Salim, Dr. Salim. I don't know if you know him, Dr. Salim.
Yes, yes. If you can see him in our group picture. We keep a close connection.
Which one is he? Which one is he, Elena? That picture. Oh, okay. All right, he's in the front. He spoke at the at a conference, right?
Yes, he's coming to Romania once a year for the Neurosurgery 101 course for students and residents. And this picture was taken last winter from the course. So he was in Romania for 5 or 6 times so far.
So, and he'll be in Kathmandu too, right?
He'll be in Kathmandu, and then he's gonna come once again in Romania this year as well in October, where it's gonna be the Romanian Society of Neurosurgery meeting. And I'm inviting Dr. Marco and Dr. Noro to come as well. Dr. Marco, Romania is not that far away.
Everything's so close, just a train ride away, right?
You have one event to Nepal in September. I don't know if it is correct. Yes, you have one event about Walter Dundee in September in Nepal.
Okay.
It's a meeting. It's the first time I'm attending it, so I'm really looking forward to it, but I don't really know what's gonna happen there.
Oh, okay.
It's gonna be one.
Okay. So now in Romania, which time you have meeting in Romania?
I am in Bucharest. Bucharest is the capital of Romania.
When is going to be this meeting, Helena?
In Romania?
In Romania,
yes.
In September?
No, in September.
No, that's Kathmandu.
Then the global meeting.
Okay.
I can give you the link if you want to register for it.
Okay.
The program is not, or at least last time I went on the website was not posted. And we're gonna have here in Romania the meeting of the Romanian Society of Neurosurgery, and we're gonna have, of course, Professor Salim invited as well, and other faculty from Europe.
Good.
Which time? Which month in Romania?
In Romania, it's gonna be at
October?
the end of October.
October, okay.
And October.
October.
To 28th, I think.
Mm-hmm.
Okay.
Good.
It is okay.
Okay.
I will see.
Very good. This is
Thanks
a new
for inviting.
experiment. Thank you guys for helping
the
experiment. Did you have anything else to say, Nuru?
You say?
No, okay, we're going to wrap it up now, okay, because Elena probably has a little work to do, and all you guys do, I'm sure.
Yes.
Thank you so much
Thanks,
for
Elena, and we look forward to hopefully doing it again next week if we can. We'll find a format. You know, having a couple neurosurgeons in here helped a lot because they could discuss a case and stuff like that. We'll see where the conversation goes. So please stick around. Let me just end this formally. Thank you.